When nurse Jennifer Walsh accidentally walked into the wrong wing of Metropolitan Medical Center, she discovered patients who weren't supposed to exist. Room 237 through 245 contained people who had been declared dead months ago, but they were very much alive, and very much being used as test subjects for experimental drugs that hadn't been approved for human trials. What she saw next made her realize she wasn't just witnessing medical malpractice, but a systematic human experimentation program that made Nazi experiments look humane. Jennifer Walsh had been a registered nurse at Metropolitan Medical Center for 8 years. She knew every corridor, every elevator, every restricted area. So when she took a wrong turn during her night shift and found herself in a wing that didn't appear on any hospital map, her first instinct was confusion, not alarm. The hallway looked identical to any other. Sterile white walls, fluorescent lighting, numbered rooms. But something felt wrong. There were no nurses' stations, no visiting hours signs, no normal hospital sounds. Just an eerie mechanical humming coming from behind closed doors. Room 237 was the first door she tried. Using her master key card, Jennifer stepped inside and immediately felt sick to her stomach. The patient in the bed was connected to more machines than she'd ever seen in her career. IV drips containing unknown substances, brain monitoring equipment, and what appeared to be experimental devices she couldn't identify. But it was the patient's face that made her blood freeze. She recognized him. Marcus Chen, a homeless man who'd been brought to the ER 6 months ago with pneumonia. His death certificate had been filed weeks later, citing complications. She remembered because she'd been the one who'd prepared his body for the morgue. But Marcus was alive. Unconscious, but definitely alive. His chest rose and fell in a rhythm controlled by machines, and Jennifer could see his vital signs on the monitors. Moving from room to room, Jennifer discovered 8 more patients she recognized, all supposedly deceased, all connected to similar experimental setups. Each room contained detailed charts tracking drug responses, side effects, and what appeared to be progressive human trials for compounds she'd never heard of. In room 244, she found Maria Santos, a young mother who'd come in for gallbladder surgery. Her family had been told she died from surgical complications. But Maria was breathing, her body clearly being used to test some kind of neurological drug that was causing visible tremors. Jennifer's hands shook as she photographed everything with her phone. Chart after chart revealed the horrifying scope of the operation. Poor patients, undocumented immigrants, homeless people, all declared dead to cover their disappearance into this hidden wing where they became permanent test subjects. The drug trials being conducted were years ahead of any approved research. Experimental cancer treatments, neurological enhancers, genetic modifications, all being tested on unwilling human subjects who had no legal protection because they were officially deceased. As Jennifer reached the final room, she heard footsteps in the hallway. Dr. Harrison Mitchell, the hospital's chief of research, approached with 2 security guards. "Nurse Walsh," Dr. Mitchell said calmly, "you're not supposed to be here." "These people are alive," Jennifer whispered. "You declared them dead, but they're alive." Dr. Mitchell studied her for a moment. "What you're seeing, Jennifer, is the future of medical research. These subjects have given us breakthroughs that will save millions of lives. The cancer treatment we're developing could eliminate the disease entirely. The neurological enhancements could cure Alzheimer's, Parkinson's." "By experimenting on people who can't consent," Jennifer interrupted. "This is murder." "Is it murder if our research saves 1,000 lives for every subject we use?" These were people society had already forgotten. Homeless, undocumented, terminal patients. We gave their deaths meaning. Jennifer realized the true horror. This wasn't just Dr. Mitchell. The security guards weren't surprised by what they were seeing. The missing death certificates, the altered records. This conspiracy went through every level of the hospital administration. "You have a choice, Jennifer," Dr. Mitchell continued. "You can join us. Your nursing skills would be valuable here. Or ... The implication hung in the air. Jennifer had seen too much. She could either become complicit, or she could become the next test subject. "I need time to think," Jennifer lied. "Of course, but Jennifer, you understand this conversation stays between us." That night, Jennifer didn't sleep. Instead, she compiled everything she'd photographed and documented into a comprehensive file. Hospital records, death certificates, and photos of people who were supposed to be dead but were being used as human lab rats. By morning, she'd uploaded everything to a secure server and sent copies to investigative journalists, the FBI, medical ethics boards, and human rights organizations. The story broke within hours. The raids began that afternoon. FBI agents found not just the 9 patients Jennifer had discovered, but an entire underground network of experimental facilities using deceased patients as permanent research subjects. The investigation revealed that Metropolitan Medical Center was part of a larger consortium selling human trial data to pharmaceutical companies worldwide. Dr. Mitchell and 15 other medical professionals were arrested. 8 pharmaceutical companies faced criminal charges, and 9 people who had been declared dead were finally able to return to their families. Jennifer Walsh had saved more than patients that night. She'd exposed one of the most horrific medical conspiracies in modern history. But as she testified before Congress about the need for stricter oversight of medical research, she couldn't shake the feeling that Metropolitan Medical Center wasn't the only hospital with a secret wing. Jennifer Walsh's courage to speak out exposed a medical horror that reads like science fiction, but was all too real. Her story reminds us that sometimes the most trusted institutions hide the darkest secrets, and it takes one person willing to risk everything to bring justice to light. If this medical thriller shocked you into questioning what really happens behind hospital doors, subscribe to The Frontline Voice for more stories that expose hidden corruption. Hit like if you believe healthcare should heal, not harm. Tell us in the comments how many other hospitals might have secret wings like this. Share this story because everyone deserves to know the truth about medical experimentation. Until next time, remember that the most dangerous predators often wear white coats and carry stethoscopes.